Hello friends, this is Dr. Ezeugwu again coming to you, specifically today to talk about the care of the foot, especially for the diabetic patient. This is a second part of a previous presentation talking about the structures that are inside the feet. For a diabetic patient, the care of the foot becomes extremely important to prevent complications and things that may lead to loss of the feet or limb. If you're a diabetic patient, it is important that you're seeing a podiatrist to help care for your foot. If you take a look at this structure for this foot, you can see there's a little ulcer here. Some patients may feel that or may not even know that it's much of anything. They think it's just a little blemish on their feet. Or you can even see a little scratch like over here. Or you can notice maybe some little changes here that doesn't really mean much of anything to you. Worst of all, if you're not even feeling any pain because you have some kind of neuropathy that numbs the feeling. This thing you're looking at like this can go from this way it is to the next, where this is like a big ulceration like this. This sets you up for bad infection and even a nail getting into the foot, leading to major infection of the foot. The thing about this is that if you ignore it, this infection can actually invade your whole body or lead to loss of this limb. This is stages of things that can happen to you with diabetes, and it can go from different stages. So I'm just gonna go to even this part of it where we just talk about just the blood flow to your feet, where you start getting some discoloration or where the feet is just turning blue because there's no much of blood flow to it. You can go from this bluishness to the next thing is the foot will turn black. And usually when it happens like that, that means there's no blood flow to that area, and what the doctor will be left to do is really to amputate this. And so you see patients who are diabetic have lost a limb or a toe or a tooth, even sometimes they can get cut off down here. You have seen patients who lose those, but these are all preventable things that if you work with your doctor and work with your podiatrist, you can actually prevent these complications from happening. Again, this is Dr. Ezeugwu talking to you about diabetic foot care. Thank you.